Guys, our patient from
Japan.
greetings to wonderful Japan, but originally United States, right?
Originally United States.
Okay, and greetings to New York, by the way. Mike, what is your height? What is your current height? And what is the goal with the quadrilateral limb lengthening surgery?
I was just measured at 171, and my goal is the 14 centimeters with the Precice.
Which means 185. Can you tell your height in inches and
Probably 5'7" range.
right now?
5'7" and a half, 5'7", about that.
And 185 is how much inch?
Maybe around 6'1".
Wow, it's crazy. So can you explain me? I know it was really short, but you step on the 14 centimeter. How was the feeling for you?
No specific feeling immediately. Obviously, that will develop as time goes on, but you know, it's going to be different once I am that height.
The most important question for me as a patient who did the lengthening surgery done also is why you decided to undergo the limb lengthening surgery.
Well, that's obviously a long discussion, but I didn't even know that this was possible until I came across your videos maybe about 5 months ago. And I just binge watched everything on YouTube and Instagram, and I did a lot of reading just across the internet, and then I made the decision pretty quickly. Within about a month, I knew that I was going to do it. But in terms of the long-term reasons, I mean, there's a lot there. Obviously, it would be nice to be taller in general. In terms of my life, there are more specific things, yes. My dad, for example, he's around 5'11".
Wow.
So I feel like I've never grown up.
Okay.
That's been, when I tried discussing it with my dad, that was a question he asked specifically. He goes, but like, why do you feel the need? Yes, it's okay if you want to be taller, but what's the core reason? I said, look, I'm not as tall as my father. I'm literally speaking to him. I'm saying it in third person. I'm not as tall as my father. And I think that psychologically, I feel like I've never grown up. That I don't like using the terminology height dysphoria because I don't think that there's anything wrong with wanting to be taller. I think that if I were to merely reflect on the source of why I definitely want to make this happen, beyond just saying it would be nice, like what's a core reason that I'm more actively engaged in making this happen, I would say the feeling originates from childhood that way, just that I never really grew up compared to my dad.
Wow.
Yeah.
I mean, I had the same problems for sure. I totally understand and respect you. Okay, thank you very much, Mike. So, and you are a doctor as well, right?
I am.
Great. And so you decided to trust your life in us, Livelifetaller. What is to us? What is the reason for that?
Biggest reason is definitely the community aspect. You put everything in terms of content out there. You do what you need to do in that regard. Obviously, extremely helpful. And so, it's absolutely it's not just the surgery, but it's the rehab, the community, being able to interact with patients, the staff, having everyone there, physiotherapy, nutrition. It's the total package in that regard. So I'm not just, sent off to a hotel on my own and then I'm not checked on. That I'm confident in the totality of the process here and that my concerns and questions are addressed throughout. So, but that was definitely it. And just in general for the content, but also for you, yes, it's really putting out there that the community element. People who decide to come here, they're aware that they can go to any surgeon technically, but it's the community, being able to interact with patients, knowing that you're not alone, and that makes things a lot easier for sure.
Thank you very much, Mike. I really appreciate it. And I will say, let's start the journey. And after a few months, yeah, he will be taller than me and I have to look up. Let's enjoy the moment for me also. And yeah, see you guys in a few months.
Hello everyone, today I'm with my patient and he did quadrilateral surgery, Precice femur and Precice tibia at the same time. And today we're gonna show you how we can do lengthening with ERC device. And if you're ready, we can do it.
Yes, there's no pain during the lengthening. He was just asking me that before we started the video. Day 8, as he just said. Day 7, yesterday, post-surgery, was extremely painful. Today, not as bad in terms of the swelling pain from the surgery itself, but I've noticed some new pain today, sharp pains in the calves especially, or not the calves, the shins, the growing pains, right? So, yeah, so we're just gonna do a lengthening of the femur here and some of you who've seen some of the content already on Instagram and YouTube know that it's loud when you activate the magnet. So, so it's about 2 minutes for 0.33 millimeters for femur and tibia. So 3 times per day for each. So 2 millimeters per day, which I just started at that rate yesterday. And I mean, that's pretty much it. I'm not going to act like I'm a guru when it's day 8 for me.
It's still early.
But he's obviously the head physiotherapist, and he's really good. So,
Thank you so much.
you know, we had some sessions already, and
Thank you so much.
it's so obvious how vital the physio is to the process that you can have a perfect surgery. And I was told, you know, your surgery perfect, and you know that could be, let's just throw out a number, 5-10% of what actually matters, right? You have a perfect surgery, but then okay, if you go off to a hotel somewhere and you're not doing physio, you're not doing stretching, you're not getting the nutrition you need, you're not going to achieve your goals. So the fact that I'm here, the fact that I have staff around me, the fact that I have, you know, 24-hour nursing I can call, just everything I need is the community with other patients here I can talk to about their experiences. I mean, that's obviously why I chose Livelifetaller, and it's lived up to it so far. In fact, it's beyond what I could have anticipated so far. I'm just annoying because, you know, I'm just talking, but you know, he's a pretty tall guy, you know. It was a 191?
Yeah, I'm 191.
191. So most of the patients aren't going to hit his level, but I started 171, maybe 185, 186. I'll get to it, the Precice.
What do you feel when you see the other patient?
Yesterday, I met a patient for the first time who, you know, I guess around 185, and I didn't know who he was clearly, but I walk into the physio room, I see a guy, clearly he's had the Precice done because he doesn't have the LON attached to the legs, and my initial impression is like, oh, he's tall, and one of the physiotherapists said, oh, you know, he did what you did and he's finished, and so that's pretty much it. I mean, it's just the data point of you see a patient who's tall, who's done the quad Precice, and you know, the idea, the notion of actually getting there, because when you're lengthening at 0.33 millimeters, you say like, well, you say like, is this actually like happening? Like, is this actually like lengthening? But you know,
Maybe after 5 centimeters later, you're gonna feel the difference. Maybe also we are taking picture every centimeter. That's why we can check before after picture also. And you feel that?
Yeah, so you know, not just that patient, but also even there's another patient who has done quad Precice, who's I believe week 3 or 4 right now. So he was amazing to briefly chat with, as far as like, he's like, oh yeah, you know, the first week, what you're going through right now, like that's the worst. And you know, I see him, he's mobilizing a lot better than I am. Like I'm using the walker right now and a lot of pain. I see him mobilizing on crutches. And so you have that just that shift of just a few weeks, and you say that's what I can look forward to.
The hard part is the beginning. I mean, right now, because you have still swelling, that's why it's hurt, and it's not like when you do daily routine, it's fixing you. I mean, fixing your flexibility. That's why we should a little bit wait, and also we are using some special device for controlled swelling. Mobilization is really important, also because. You are doing lengthening every day. Also, we can say every couple hours you are doing lengthening. That's why your body anatomy is changing, body giving some reaction. For example, in the morning he had pain this part, and every day it can be changed because your anatomy is changing. As I said, your soft tissue is not just a bone lengthening. Your soft tissue is getting tighter and tighter because every day you are doing lengthening.
Yeah, I mean it's a lot of work. Okay, so as he mentioned. The number, and some other staff have mentioned, is that the number one way to help mitigate the pain, help the pain go away, is to mobilize, which causes a lot of pain when you're trying to get up and you just have contact with the floor. The importance of weight bearing, obviously vital when you need the bone to be stimulated with gravity. So, you know, it's a lot of work. You know, so just some friends will text me from overseas and say, well, you know, what are you actually doing? I mean, apart from physio, like, and I say, no, you don't understand. Like, it's not like I'm just like sitting in bed doing nothing and then I lengthen 6 times a day. It's not really that. Like, every time you lengthen, you have to, then you stretch afterwards, which is a lot of pain. Then you have to think about just, okay, my nutrition, I need to fit in eating right now. Then I have to use the toilet, which activities of daily living, very difficult when you're initially going through this. So it's a lot of work. And I would say that for those of you who are going to do this, you really need to understand that when you come here, it's a full-time job. Some of you will have work that you're doing, of course, like, you know, through the computer, and you can do that stuff like in your room while you're here, but mentally, it's a full-time job, constantly, you know, the stretching, the pain management, the mobilizing, and the physio is vital. So I'm starting off at physio sessions 2 per week right now, various techniques in terms of stretching, they call that manual, just, you know, varying things, but massage techniques, etc. So,
and we are starting 2 sessions per day with him right now. And next week we can start the gym session. I mean, he's able to use Alter G also. Next week we're gonna start the Alter G. It will be like a level up for your lengthening process. And then he have still open wounds. After this wounds close, we can start to go to hydrotherapy too. And then you will be good, you know, can reach your goal. As I said before, don't focus on the number. The important thing is
I'm focused on the number, okay? So I mean, that's what it is. He's not focused on the number because he's already 191, right? Like, no, in a true sense, yes, you need to listen to your body, and every patient's going to be different. It's true, but regardless of your starting height, yes, we all want to achieve certain numbers, and then when you get here and you're actually engaged in it, there's a level of humility that you're going to come to terms with, and you say, you know, look, I might be shooting for 14. Apparently 14.5 is possible with Precice, because I wasn't even aware of that. But the point is, you'll be thinking of certain numbers you want to hit, and then, you know, when you come to terms with the process of how difficult it is, you say, like, even if I get 13.5, or, you know, I'd still be content.
we will do best.
Do
But
best you can.
as I said, don't focus the number and just focus your exercise. If you will listen to us, I mean, if you will listen to stuff, I'm 100% sure you will reach your goal. Yeah.
So I was asked about my pain tolerance before I had this, the day before the surgery, when I was meeting all the staff, and I gave an 8 out of 10, which was brought down to earth real quickly now that I'm post-op. And the pain is always there. The pain is significant. It's a balance between, you know, depending on your personality style, okay, those of you who are considering getting the surgery, you know, you got to be a man about things, but at the same time, also have the humility that, you know, it's a real thing. It is difficult, okay, so I'm adjusting to a new baseline of significant pain, and you have to recognize that the pain literally equals the growth. That's what it is. So it's not a bad thing. You know, it should be difficult. I think that's a key point. Is this isn't just like going in, getting like a, you know, a one-off procedure and then you're done, you walk free. It's like, this should be difficult to achieve. And so the pain medications, you know, I would like stronger control of the pain, but I am trying to minimize the amount of pain meds that I'm going to be dependent on, just in terms of, you know, I have a medical background, knowledge as far as what medications can do, etc. So the team does a really good job of making sure your pain is managed. They will fully manage your pain, but you have to understand that, you know, you need to drink a lot of water. You need to make sure your nutrition's top, and, you know, you don't want to really become dependent on the meds. You need to mobilize, right? The walking being the best thing for the pain, which I'll figure out as I'm mobilizing more. That's all.
Yeah, think like that. When you walk, it's like a warm up, and then your muscle will be, how can I say, like more flexible. It's enough to control the pain sometimes.
Yeah, so I mean, that's pretty much it for the pain control. It's difficult, but I gave an 8 out of 10 before the surgery, but I'd say maybe now, I was only sitting at like a 6 or something, you know, in terms of ability to handle pain.
I think it's also just for this part. Maybe next week you will be much better, because you are the Precice, you choose the Precice. It will be much more comfortable than LON. I think like that, but let's see.
Yeah. Either way, I'm really happy for the team here. Okay, as I said, so all the staff, they come see me, they follow up with me. I have everything I need in terms of access to food, access to, you know, if I have any questions overnight, I can text the staff here. People come to me. So very comfortable. Everything you see in the Instagram and the YouTube, it's real, okay? And so this is, I'm very happy with having come here.
Thank you so much. If you're ready, we can do lengthening right now.
So obviously this looks like a game, some sort of video game controller. It's pretty heavy. I don't know, maybe like 7 kilos or something. It's pretty heavy, but when you activate the magnet, it takes about 2 minutes, 0.33 millimeters, and it's loud. Okay, if you ever have an MRI, it's loud. So you want me to do it and then just pause it after?
Do you feel anything?
I don't feel anything. So I'm gonna pause it. And then I can just resume it here, and it has everything in terms of the measurements. So you don't feel anything during the actual lengthening process. And I mean, that's pretty much it. It's just, it's very simple.
That's all.
That's it, it's very simple.
Again,
I'll just resume.
Thank you very much for your cooperation, and see you in a few months. Thank you. Thank you.